The other major issue, we continue to confront our outbreaks or clusters of cases at 278 different facilities across the state, including 4,011 confirmed cases at 143 different Maryland nursing homes. These outbreaks account for 19% of all the total positive cases in our state. But shockingly, 46% of the deaths in Maryland are patients from nursing homes. We have augmented our Maryland strike teams with 3 disaster medical assistance teams. These elite teams bring many years of disaster relief experience.
We were invited by the state of Maryland through the Federal Emergency Management Agency to come in and provide some expertise in their fight against COVID-19 within the nursing homes.
We're supporting the Maryland Department of Health. So what we've been focusing on here in Maryland is taking care of the people who are at increased risk but are in small communities where they can't move very easily.
These have been areas where some of the patients have been the most vulnerable, and we've seen some of the highest death rates. So what we bring to the table in partnering with the National Guard, Emergency Medical Services, the Department of Health, is that we have a certain degree of expertise with COVID-19. A lot of our personnel have already been in the field working with these patients, evacuating these patients, providing isolation techniques, and we've had a lot of in-depth training that we've done in combination with the experts at the University of Nebraska Medical Center.
We're headed out to a nursing facility to take a look at their staffing and their infection control practices, give them some resources to use so that they can continue to make improvements and continue to provide safe care for their patients.
We are a small group home. It's a home environment.
We just had a briefing for the facility and we're going to go in gowned up and assess the situation.
Okay, you want to check? We're here with the Maryland National Guard today, and we're here helping the state of Maryland. Today we're actually here to assess one of the small nursing homes in the state. We're here to look at their usage of PPE and look at their isolation procedures and to do a quick assessment on some of their patients. We're here just to help them with the COVID-19 outbreak. We're glad to be here.
We've been inside inspecting the facility, looking at their isolation procedures for the COVID-positive patients and for the residents that are not COVID-positive patients. Between us and the Maryland National Guard, we've done a complete assessment of the place and offered a few suggestions for them, and they've been very thankful for us to be able to come and assess them and give them some ideas for the future.
We're not used to having groups come in to help us. It was very helpful to have a group that was coming in that very much felt like it was to benefit us as opposed to critique us. They came with a variety of backgrounds and shared with us insight from their experience and their own areas of expertise, and helped us to think through the different processes that we're doing and what could be improved, what we were doing well. And they were very, very helpful in a number of areas.